Welcome back, everybody. My name is Laura Jackson, and I am with Wellmark Blue Cross and Blue Shield. And I want to start by saying a big thanks to the Healthy Birthday team. Wellmark has been a long fan. I see Janet back there. I saw some others. Been a big fan of your work for a very long time. And so we just want to thank you for putting this symposium together. And I'm here really for three reasons. First of all, I'm an Iowan, and I grew up in a rural town. And I also am a mom, and I got that wonderful designation when I had my one and only child as AMA. And I remember saying to the OB-GYN, American Medical Association. He's like, no, advanced maternal age. And I went, oh. So, you learn a lot of things along your journey in life. But I'm proud to say that if I would not have probably delivered in Des Moines, and I would have delivered in my hometown, I don't know that I would be a mom today. So I'm really proud of all of you to show up today to really want to learn more and do more on this very important topic. I'm also here as a member of the senior team, but most importantly, I have responsibility for the Wellmark Foundation, and I also chair the board of the Wellmark Foundation. And the board was thrilled when we said, we really want to step forward and sponsor this because we care deeply about what's happening in our state for moms and babies. So we're pleased to be able to support the symposium. And I'm also here as a continuous learner because I think that we are all faced with the opportunity to solve old problems in new ways. And you can't do that unless you continually learn. And there are just a slew of experts here today that we all can learn from. And I think that's why you're here too. So it's a good start to an awesome day. Okay, so I wish everybody was back because this is going to be a question that I'm going to pose to you. Are you ready? So I'm going to set the stage and tell you that I'm going to force you to make a choice. You're going to get two options to raise your hand because I really want you to think about what's happening in our state. And what I'm going to ask you is, first of all, if you had to choose, and I mean you had to choose, would you like to live a long but an unhealthy life? Meaning you make it to your mid-80s, but you have chronic conditions or you have something that's really challenged you so that you can't live your best life. Or would you like to live a short life, but you're very healthy, so maybe into your 40s, but you don't get to live that long. So with a show of hands, I'm going to give you those options again. So and remember, you have to choose. So if I see you and your hand isn't up, you don't get the free car that we talked about. See, people are walking in, they're like, free car? What are you talking about? Okay, so the first option, how many of you would like to live a long but an unhealthy life? With show of hands. So few, okay. How many of you would like to live a short life but healthy? Okay, so probably a little more on the second option. And the reason that I wanted to share this question with you is some people get born into circumstances or they fall into circumstances where that choice is made for them. Because where you live and the environment that you live in can dictate how long you live and how well you live. And what we did about a year or so ago at Wellmark is we started a brand new division. And the mission of that division that I'm privileged to lead with a team of people is that we believe every Iowan should have the ability to live a long and a healthy life. They need that opportunity. So we have to go upstream and even sometimes mostly outside the healthcare system to remove those barriers and meet people where they're at and really start to look through the data and find evidence that we can actually change that trajectory. Because we have too many people today that aren't living a long and a healthy life. They choose one or the other by nature of the circumstances that surround them. And you heard that this morning when we talk about birthing center closures, right? That can change things dramatically for people. So if the mission for our focus is to make sure that Iowans live a long, healthy life, you might say, well, why would an insurance company want to do that? And I'm going to tell you why. We all know that the cost of healthcare has become so incredibly expensive, and it's becoming unaffordable and unattainable. And the word affordability is even hard to say when it comes to healthcare today. And you might say, but you're an insurance company, do you really care how much it costs? And the answer is absolutely. Because when it costs too much, then we have conversations like we just had this morning, like, it's not a moneymaker, we need to close that birthing center. So we can't afford to spend more money on things after we find ourselves in bad situations. We want to go upstream. We in this country don't spend enough money on prevention and creating great communities where people can thrive and live a great life. And we also what we want to do is make sure that we stop thinking that we go get health at our doctor's office. Health occurs long before you ever show up in your doctor's office. So we need the help of people to help us through childbirth, to help us with that prenatal care, to understand that we have to do the right things before we get pregnant, before we have that baby, and long after we start to care for them. We're gonna need others to help us to meet us where we're at. So here's what I do know. When we set this mission out, I do know that we can't do it by ourselves. There is no company, there's no person, there's no entity that is going to change the lives of Iowans, and it means that we have to do it together. So here's what we do know. You all know this, and I can't remember based on where you all came from, but I know there's a fair amount of people online. But Iowa is a largely rural state, which you heard this morning. And when we think about our rural communities, they are absolutely critical to really the health of our entire state. Right? We need them. We need the rural communities when it comes to the agriculture and what they actually produce for the economics of the state. And I agree with Dr. Wells, not everybody would want to live in rural Iowa. I kind of enjoyed it, right? And so we need to make sure that we meet people where they're at and solve the problems differently. So here's what I do know before we actually introduce our next speaker. There are things called ripple effects, right? One small change makes a big change, right? The pebble in the pond. But one small bad change can create a ripple effect in a negative way, which means we have to look for those things that change it for the positive. And here's what I know for certain when we talk about this topic today. We know for certain that place matters, we know that healthy behaviors matter, and we also know that access to quality care matters. So when you think about those three things, what I hope that you all take away from today is that we need more people than just the folks in this room and online to understand what's happening in our state. We hope that once you understand it, you actually start to care, or care more than you do today, or create a situation where you care deeply, but you got somebody else to care as well. So we go and do something about it and change the trajectory. And I know that we can do it. That I have no doubt. So as we think about teeing up our next speaker, I have no doubt that she is going to give you even more things to think about through the evidence, through the research, and what we can do about what's happening in our rural communities. So with that, I'd like to introduce to you Dr. Julia Interante. And Dr. Interante is a research fellow and a statistical lead at the University of Minnesota's Rural Health Research Center. She holds an MPH in epidemiology from Emory University and a PhD in health services research from the University of Minnesota. Her research examines the effects of policy on maternal health outcomes, and you heard a fair amount of folks talk about that this morning as well. In addition to that focus on the policy, she also focuses on access to maternity care services with a specific focus on geographic and racial equity, which is also a challenge in our state. And this includes topics such as disparities in severe maternal morbidity and mortality, changing access to rural maternity care, and the impact of payment policies on maternal and postpartum care.